Hello, I'm Daniela Prayer from the Medical University Vienna, Austria. Today, I want to present you the new version of the MR guidelines for fetal magnetic resonance imaging. You may ask, why does a top journal dedicated to ultrasound publish guidelines for magnetic resonance imaging? Well, as you probably know, fetal MRI is mainly an adjunct and a complementary method to prenatal ultrasound. The new guidelines want to answer the questions: what are the circumstances when you would like to use fetal MRI too, in addition to a previously performed ultrasound? Imagine you are a sonographer and you want to confirm your ultrasound findings. Or perhaps you are an obstetrician and your patient got an ultrasound report talking of an isolated finding. And you just want to see whether this isolated ventriculomegaly or corpus callosum pathology is really isolated or not. Or you get the results of a genetic workup reporting a strange, never seen before chromosomal abnormality, and it is completely unclear whether this chromosomal abnormality may cause an impairment of fetal organ development or not. And you might want to get an MRI to answer this question to a better degree as maybe ultrasound alone. Or your patient has surfed the internet and she knows something about fetal MRI, but now she wants to know whether this method will help with her specific diagnosis or not. Or maybe you are a scientist and for whatever reason you want to conduct a comparison study between ultrasound and MRI, and while you stick to the criteria, the guidelines of ultrasound in any phase that you know, you just compare it with random MRI. In this case, when you end up with a badass reviewer, you will not be able anymore to publish such results in the UOG. However, what we wanted to do, we wanted to address with these guidelines anybody involved in prenatal care, and we do hope to be able to answer the main open questions for you and your patients.